Hello, my name is Ray Anu, and my topic is chlamydia trachomatis. So what is chlamydia trachomatis? It is a sexually transmitted disease, and it is a result of chlamydia that men and women can contract by having sexual intercourse. The words chlamydia trachomatis have different meanings towards it. Chlamydia stands for chlamydia, while trachomatis is known for ocular infection that can cause blindness. It is a gram-negative bacteria that is anaerobic and is an intracellular obligate that is located in the eukaryote cell that can be replicated. Going deeper into trachomatis, there are 1.9 million people who have become visually impaired or blind because of this infection. This infection can spread by personal contact, by hands, clothes, or bedding. Sadly, this infection is irreversible for those who already has chlamydia trachomatis inside of their body. The people who are most common to contract this infection are preschool-aged children because of how young they are, and that makes them more accessible to the infection. If the infection persists and is ongoing for years, the inside of the eyelid becomes scarred and will cause the eyelid to turn inward. That will later cause the eyelashes to brush against the eyeballs and will cause pain and light intolerance. If it is left untreated, it would become irreversible and would result in visual impairment and blindness. A way to prevent this infection from going any further, surgery could be a way to help treat the blinding stage, some antibiotics for infection to help clear it, facial cleaning, and to have environmental improvement. So what is involved? You have the EB, which is the elementary body, the RB, which is the reticulate body, nutrient phase, how the RB is cleared. Then you go into the heat shock with the lytic cycle and the morphological adaptation, inclusion formation, the innate immunity, and as well as the adaptive immunity. You have the natural killer cells, the alpha, beta, and the gamma delta T cells, the B cells, and glycolysis. So what is EB? EB is short for elementary body. How does it play a role in all of this? It will penetrate through the cell of the epithelial in the host's body and has a type 3 secretion system complex. It will then leave the cell while the RB is duplicating back into EB. The elementary body relies on the outer membrane protein that is like a projection of needles, and it is located in the outer membrane protein matrix that can later be identified as chlamydia T3SS. That will be in cell adhesion and entry. What is RB? RB is short for reticulate body. While RB is duplicating itself back into the elementary body, it can do it within one of three ways. It can either have vesicles where they are exocytic that can bind together with the lysosomes and will result in it being exocytic. But another way is dealing with nutrients that includes cholesterol and phosphatidylcholine that will go through a sequence. The third way is by having a pathway that can survive through modulation. When chlamydia trachomatis is having an effect on the immune system, the immune will have a response that will result in the starvation of the infection. By having the RBs die and there is no infection, or by having the RBs alter the gene by going through transcription and metabolizing the persistent stage. So what happens in the nutrient phase? The nutrient phase is from the reticulate body, and it is one of the three phases that RB goes through before duplicating itself back into the elementary body. The reticulate body will be able to replicate that would then halt the process of metabolism until the RB goes back into the infectious EB, and it would be determined by their size and how large they can get. The host cell will then lyse that will later then be considered as dependent for the plasma membrane and for the cell to rupture. It will go through the lytic cycle that will later release the damage-associated molecular patterns, or DAMPs for short, that would then have an increase of immunogenicity that would then be released. When chlamydia trachomatis is having an effect on the immune system, the immune will have a response that would result in starving the infection by having the reticulate body die. When there is no infection, or when the RB has to alter the gene by going through transcription and metabolizing the persistent stage, once it is cleared, the infection will not be induced anymore. And that will lead to the tryptophan increasing as well as having the amino acids available once again. There is the other route where the reticulate body has to alter the gene by transcribing and metabolizing. That is when the infection enters the intracellular development of reticular body, go through the survival mechanism to have the immune attack. So, what is heat shock? Heat shock is a protein that when the cell is under stress, it is upregulating, meaning that it will try and survive through the denaturing and try to prevent from being misfolded. But since it can't, the prokaryote and eukaryote cell will undergo stress and they will upregulate. When the lytic cycle happens, the infection will infect the immune response in many ways, but two ways are known as the morphological adaptation and the inclusion formation. The morphological adaptation has LPS on the surface of the elementary body that will then reduce their levels. LPS is lipopolysaccharide, and its function is an endotoxin that involves gram-negative bacteria that can lead to fever, hemorrhaging, and septic shocks as symptoms. Going back to the morphological adaptation, it can help the immunity developmental cycle by having an enhanced structure to help them by the disulfide bonds that will cross with the MOMP. The MOMP is a major outer membrane protein that has an ability to detect the exposure by the nucleic acid amplification test. The nucleic acid amplification test is a test that can detect the infection that is currently inside of the body. So, in all, it will help the developmental cycle that will have a very high impact on the immunity in the body. Next, you have the inclusion formation. The inclusion formation deals with the protein being released because of the interruption of the cellular recognition receptors. It can help the developmental cycle by having the proteins released in the cell to help alter the intracellular pathogen. It would then help block the inflammatory cytokine and the immune response. The innate immunity. The innate immunity is the first line of defense that will prevent the infections from having any solid hold in the body. Chlamydia trachomatis affects the innate immunity by activating the toll-like receptor 2 that will have the chlamydia protein that is located in a plasmid that's encoded with the dependent manner, whereas the adaptive immunity has a specific and memory characteristic. It was first practiced in mice to see if it worked, meaning the adaptive immunity, but the T cells in particular, will try to help clear out the chlamydia trachomatis infection. But the MHC2 was lacking by the CD4 plus T cells that will reduce the bacterial burden and shedding. Going on to the natural killer cells. It can be distinguished whether or not the cell is infected by the chlamydia infection. When it is infected, the NK cells will go into the infected tissues early, help produce early interferon that can help the adaptive immune response. Now, you have the two main subsets, and those are the alpha beta T cells and the gamma delta T cells. They are both types of TCRs that can recognize the chlamydial infection that's inside of the body. and they're peptides that are on either the MHC1 or the MHC2. The MHC1 will be present on the cells that are forms of the cytosol to the T cells. The cytosolic proteins are originating from the intracellular pathogen but are degraded by the proteasomes. As for the MHC2, it is on the APC that includes the dendritic cells, macrophages, and the B cells. Speaking of the B cells, it is originated in the bone marrow that will help the adaptive immunity. In the B cells, the chlamydia will be less apparent than the CD4 plus T lymphocytes. That is very important when the chlamydia is involved because it will then help the T cells by differentiating and activating. When the infection goes through, the T and B cells will try to fight off the infection, and that's when glycolysis comes into play. When chlamydia trachomatis is infecting the cell, it will be dependent on the host cell and will undergo the cycle. The epithelial cells, the vacuoles, lumen, elementary body, and the reticular body are involved in the process, so it's glycolysis, but it would have to go through the ATP. The reason as to why glycolysis is involved is for the bacterial growth of the chlamydia infection. It will go through the electron transport chain to produce ATP so that it can go through the oxidative phosphorylation. While going through oxidative phosphorylation, glycolysis will rely on the enzymes that are involved and will turn into pyruvate and NAD plus to NADH that will later produce the ATP in the process. The three bacterial enzymes that are present are glucose-6-phosphate isomers, fructose biphosphate aldolase, and pyruvate kinase for the beginning, middle, and end of the glycolysis pathway. The study that determined the increase of decrease for the enzymes that would be present when the host glycolytic were positive or negative. Like I mentioned in the beginning, both men and women are affected by this bacteria. In men, it can lead to prostatitis, reactive arthritis, and proctitis. In females, it can cause problems to their cervix, miscarriages, and infertility. For men, they can show signs of epididymitis, reactive arthritis, and urethritis. Epididymitis is pain that is located in their testicles. They will feel testicular pain and tenderness, palpable swelling of the epididymitis, and a fever. Reactive arthritis can affect 1% of men who have urethritis, and will have reactive arthritis triad that consists of arthritis, urethritis, and uveitis. Urethritis is also another thing that is common to see in men. It will lead to dysuria and urethral discharge that is usually white, gray, or sometimes clear. In women, they would have cervicitis that can affect 70% of women, but it will also lead to them being asymptomatic or have mild symptoms. Cervicitis can have its own symptoms as well, and that is vaginal discharge, bleeding, abdominal pain, and dysuria. Pelvic inflammatory disease can happen in the upper reproductive tract that will cause women to have symptoms like nausea, fever, and chills. Pneumonia is another sign that women can have when they're pregnant. When the woman is pregnant, the infant can also have pneumonia as well as nasal congestion and coughs. The woman is infected more by the chlamydial infection because not only are they infected, but when they're pregnant, it can also infect their child. Going more in depth on the woman, it can lead to infertility because of the disruption of the fallopian tube epithelium. When the fallopian tube epithelium is in contact with chlamydia trachomatis, the tube is scarring the tubule integrity. The autophagy of chlamydia trachomatis is dealing with homeostasis and whether or not the mitochondria, inflammasomes, protein aggregates, and the intracellular bacteria or viruses is affecting or not by removing it from the cytoplasm. Before going through a treatment plan, you have to get diagnosed by a physician first. A diagnosis is for the patient to know for sure that they have the chlamydia infection. One way that a person can know for sure is if they have the infection or not is by going through a screening. For men and women to know if it's present in their body, they also need to know who they have previously been involved with. For women, the screening test involves a swab that will be in the cervical area, or they can do a first void urine test. And men, they will get the swab done, but it will be in their urethral. Or they can do the same and get the first void urine test. If the infection is located in either of their oral or rectal area, those tests will be done by a swab in those areas. After the diagnosis by the physician, they will come up with a treatment plan. A treatment plan will usually involve methods or medication. I will start off with the medication. You have 3 types, but this type is called DOXYCYCLINE. It is a pill that can be taken orally. It is for a person who is efficacious for chlamydia trachomatis of their urogenital, rectal, and oropharyngeal site. The other 2 treatments are named AZITHROMYCIN or LEVOFLOXACIN. For AZITHROMYCIN, it will be used if the patient has a higher efficacy for urogenital chlamydial infection. With azithromycin and levofloxacin, they have their own doses and how many times you will need to take the pill. Between azithromycin and doxycycline, they both have their effectiveness for treatments. One will be most effective because it is in the rectal area, while the other one would be most effective because it is in the urogenital area. After going through the treatment, you could also make up some methods. One method would be abstaining from sexual intercourse or waiting until the partner is cleared from the infection. After talking about the diagnosis, the treatment plan, and the method can help you from not contracting the chlamydia infection, you will have to have a follow-up visit with your physician. That follow-up with your physician can help you come up with more methods to steer clear of this infection or to know if you can stop taking the pill and if the infection is cleared or not. As I mentioned before, if the woman is pregnant while having the chlamydial infection inside of their body before it is cleared, they still have to go through the process of getting diagnosed, going through a treatment, and going through methods. Azithromycin is safe and effective while being pregnant versus doxycycline because it is contraindicated during the 2nd and 3rd trimester because of the risk that it can give. If the mother contracted the chlamydia infection during their pregnancy, they will go through a screening test to see if they do indeed have it and see what they can do. Before the screening test happens, you have to check and see who the mother has been involved with. We know that the child is infected by the chlamydia infection because of the mother's cervix area. When the mother's cervix area is infected, it can affect the child's eyes or pharynx, urogenital tract, and the rectum because of the mucous membrane. When the mother gives birth to the child, they would experience conjunctivitis that is present in children that are 30 days or less old. They would be evaluated by the right physicians once the mother gives birth. A method that would help prevent a child from experiencing the chlamydia trachomatis is by having the regular screenings while being pregnant. They can see how many people they have been involved with, as I mentioned before, going through the treatment plans by using the right medication and the right doses that will be in the 4 weeks, then 3 months after, again in their 3rd trimester, and at the time of delivery. Now it's time for the questions. Question 1. What animal is used in the trial? Chlamydia trachomatis is gram, that is, and is an intracellular that can replicate itself in the eukaryotic cell. Question 3. What cells are involved in helping the immune system get rid of chlamydia trachomatis? Question 4. What drugs are commonly used for treating chlamydia trachomatis? Here are the answers. Answer to question 1 is mice. Question 2, negative, anaerobic, and obligate. Question 3, the T cells and B cells. Question 4, doxycycline or azithromycin.